I've heard that in certain cities, and I know in Ocean County in New Jersey, there's one PD that does it. I know in Quincy in Massachusetts, another. Police are actually carrying, am I going to say this right, a Narcan or
Narcan.
Narcan, where it's gotten to the point where there are so many overdoses now, people are screaming to cops if they're carrying it because they're trying to revive people in broad daylight that might be overdosing or seizing someplace. Is this conversations that are having in precinct houses if you guys are going to start carrying this now too? It's that prevalent a problem?
The Narcan is carried by first responders, emergency medical technicians. We are in the process, the New York State Police, of outfitting our state troopers with it, because when they get called to an aided case where there is a possible heroin overdose, the Narcan basically can make the difference between life and death. What we're finding out also, a lot of overdoses are being not reported to authorities, is some of these heroin users actually have Narcan and they're reviving their fellow drug users. And we're trying to get to the bottom of where they're obtaining it, and also we're trying to put it in the hands of responsible authorities such as first responders and police officers so that they can deal with an emergency such as an overdose.
You know, Louis, you might be able to give the perfect perspective for this. For people who don't know Rockland County, it's really a mix. I mean, you have some tougher areas, you have some suburban areas, you even have some rural parts of your county. Give an idea on the prevalence of heroin and how it kind of reaches in all different pockets of the county, and how much it's put a tax on your police department, and what you guys used to do a few years ago versus what you have to do now as it relates to policing the drug. Try and put a human face in the kind of calls you're having to respond to related to heroin in Rockland.
Well, you know, the bottom line is, before we even get to that, we have a narcotics task force that's comprised of most of the police departments in Rockland County and the district attorney's office. And they do statistical data every day, every month. So we're getting updates all the time on people that have been arrested. We're getting updates on people that have sold narcotics to their undercover agents. And then we have street crime units that are affiliated with most of the police departments in Rockland County. So we're reaching into the community and finding out what's going on, and hopefully subverting a lot of what's happening with this illegal drug trafficking. But my colleague brought to my attention, and I don't want to take his thunder, he can elaborate on it, but a statistic that I think we need to change. And if you go to the hospital and have an overdose, they're not obligated to tell us in law enforcement about that.
Hospital emergency rooms aren't obligated to share with law enforcement the number of people they treat for non-fatal overdoses. When the overdose is a fatality, law enforcement is made aware of it, but non-fatal overdoses aren't reported to authorities, so that number could be so much higher, we're just not aware of it.
But give an idea, because I think to the general population, and I consider, when I thought of a heroin overdose, I thought of a junkie in a back alley. We're hearing that you're getting calls to high schools, to college campuses, that it's running the gamut here as to who the users are of this, which is making the problem, I get, even that much harder, because you can't just put it in a little box. I mean, that's how prevalent heroin's gotten. We've talked to a lot of our colleagues in Long Island. They've said the same thing, law enforcement. They said you'd be shocked the people that we've had to, do emergency reviving, and how many people that have gone for overdoses to hospitals, let alone the fatalities. It does run the gamut, right?
Well, it runs the gamut. You know what's really surprising is most people are shocked when you hear that this person overdosed or this person died from it. They're athletes. They're everyday people. It's not like you would picture from the 70s and 80s somebody in a back alley. They're starting by coming down off the prescription drugs, then they're starting by purchasing the heroin and snorting it, up to shooting it. But it's your everyday kid, your everyday all-American kid. And it's not just boys, it's boys and girls. It goes the whole gamut, from people that are athletes to people that are in musicals and doing shows in their high schools. It's just all over. And you want to say, you know, the upbringing is so good, and you live in a middle class, or if you live in a lower class, it doesn't matter. It's hitting every aspect of our society, at least in Rockland. Buffalo is having a rash of them. There was over 30 deaths in the state of Pennsylvania for direct heroin overdoses. And it's a $170 million business, okay, selling the Oxycontins and stuff. And then when these young men and young people can't get that high anymore. They crash right down to the heroin, and here we're picking up the pieces at that point.
And Joseph, there's this perspective, I think, that heroin had a connotation 20 years ago as being the hardest of all the hard drugs. And you're more on the front lines of this, but at the youth levels that it's getting introduced, there's this perception, well, there's marijuana, there's heroin or whatever, and the addictive nature of this drug and what it leads to in the quick spiral that we've seen in far too many cases. Is law enforcement really equipped to deal with what they have to on this level? I mean, because some of the things is, I've heard from, we got to treat this almost like an illness when the addiction sets in, and then cops are being asked to wear too many hats in this process. Speak to that.
It is a public health issue, no doubt about it. And as law enforcement officials, we're investigating, unfortunately, the overdoses. We're also investigating sales, possession, making arrests when need be. But this is an overall problem. This is not a law enforcement problem. This goes to the schools, it goes to the parents. Yeah. As the sheriff attributed to before, these youngsters start off taking the pills. Pills are so expensive, they get the same opiate-based derivative from heroin. They start by snorting it, then they start injecting it. And the unfortunate thing is with an overdose of heroin, pure heroin, your symptoms are almost as though you're sleeping. The heart rate decreases, blue lips, and a lot of times people are thought to be sleeping when they're actually overdosed from heroin. And they're found a lot of times in their beds.
And I've heard part of the challenge is it doesn't need to be injected like it used to be anymore, that it can be taken orally here, it can be smoked, and as a consequence, the stigma of it to some that might not have tried it before, they'll try it now. And you run into that too on the street?
Yeah, because you know, even when they're snorting it or smoking it, they don't think that they'll ever get to the point that they're going to inject it. They attribute it more towards like marijuana. So if marijuana they don't think is that bad for you, how bad could this? And then when we debrief young adults, they'll say, after they do it the first time, they're chasing after that high to try to get it again. And what we see is when we have a rash of car break-ins and we have a rash of minor burglaries, it's the people trying to get the money to keep their fixes up, especially in suburbia. So, you know, we can even see signs of it, and you know, when we end up in the end result arresting somebody, it always almost comes out to be the same thing, that they were doing those minor break-ins and stealing from cars and doing the minor burglaries and stuff so they can get the money to buy the $5 bag of heroin, that they were coming off of the $90 pill of oxycodone or Vicodin or Percocet.
And I know this isn't your bad, guys, but on Monday I sat down with a dad and it broke your heart. The guy did everything. I mean, basically bankrupt his family with all the treatments because you can't get insurance to cover for a lot of this. You guys have probably seen this or heard these stories yourselves. And the kid would steal from the father. They wouldn't know where the kid was. They do whatever they can to try and bring the kid back, and inevitably it spiraled, unfortunately, till the kid lost his life through the drugs. But all those ancillary crimes, you guys, they fall on your plate too. It's not just the drug bust and the arrest and the usage, it's everything to chase that high and to get that dollar. And I can imagine all the incidents, additional ones that have probably multiplied in the last couple of years that are not part of your jobs.
That's correct. Again, the petty crimes have really increased because
and a lot of times when we do arrest these individuals for these home break-ins, car break-ins, etc., it comes out that they have a heroin addiction. And the unfortunate thing about heroin, it's highly addictive. You get a rapidly developing tolerance, meaning over time you need more and more doses. So if you shoot up a small bag of it, your tolerance level comes to the point where you need it more and more. And our drug recognition experts have debriefed individuals who are in their late teens, early 20s, who said they have to get high actually 6 or 7 times a day. Because also when they're coming off of it, the withdrawal is so painful and dangerous, the symptoms from it, that they need that high to just keep away from the pain.
Well, you guys tonight definitely accomplished what I can't do with numbers, which is to put a human face on. But let me ask you the same question I'm going to be asking more experts in the coming days and weeks, which is, what do we do about it? Because you guys are on the front lines, but does it happen before they take it? Do we have to get better treatment programs for it? Do we have to stop the supply coming in? I know all of the above sounds good, but from your perspectives, what would have the most material impact so a year from now we'd be heading in the right direction on this instead of numbers getting worse?
I think this program tonight and programs like this, but more so, getting out into the community, I think that we have to start educating parents in the 7th and 8th grade as we move up, because again,
it could be their kid. They keep thinking it's the troubled
right.
kid, but it could be theirs, right?
And the thing of it is their kid today in 7th and 8th grade started with Pop Warner football, and they're great athletes, and they go up, and then they get caught into this group in a high school, any given high school. It could happen anywhere. You know, they chase the high, as you will, and the next thing you know, this stellar athlete, this scholar in school overdoses on heroin. So I think the awareness to the families about Skittle parties and prescription drugs and the likes of what they're facing as we move forward, I think we got to start educating the parents in the 7th and 8th grade. You know, the drug recognition and all of that should be started later. They do a lot of that DARE program early on in 5th and 6th grade, and by the time they get in 7th and 8th, they're more impressionable. I just think it should be done a little bit later and before they start high school. But the parents got to be aware of looking for signs and signals also.
Joseph, I'll give you the last word.
Oh, I was speaking to someone before we came out here this evening, and they said, is this like the crack epidemic of the 80s? The crack epidemic was more of an urban type epidemic of drugs, where heroin is everywhere. It's in the city, it's in the middle class suburban communities like Westchester and Rockland, and it's also upstate. And law enforcement has to get together, and we definitely have to combat this, but it starts with the families, the parents, the schools. Education is the most important.
Well, I think if anything, if you scared a few parents, myself included here tonight, I think you did your job. Joseph Lewis, I really appreciate a few minutes. Thank you very much, guys.
You're welcome.
Okay, when we come back on RFL, we're going to pivot to politics, and it's the event that made Christie and really set him apart from other Republicans, his response to Sandy, and as you all remember, this brace here with the president. But now, housing experts say the money's not getting where it's supposed to. Some are claiming politics, others are saying ineptitude. We're going to talk about that after this.